Good morning everyone, I am Dr. Dipali Nayyar and today I am going to discuss with you all about blood supply of cava morris or blood supply of oral cavity. The main blood supply of oral cavity is by external carotid artery and its branches. On the left there is a dissected human being's neck and this is showing how the external carotid artery gives away its branches. Now where the external carotid artery comes from? The external carotid artery, it comes from the common carotid artery. The common carotid artery gives away external carotid artery and then on its way it gives away internal carotid artery. You can remember this by keeping in mind a three-way pipe. The lower one is the common carotid artery, then it gives away external carotid artery and then it gives away the internal carotid artery. Now let me discuss with you all what are the branches of the external carotid artery, and then in the subsequent slide I will tell you that how these branches supply which part of oral cavity. Anteriorly it will give suprathyroid artery, lingual artery and the facial artery. See in the diagram, it is very clearly seen that how and where it gives the branch. Posteriorly, that is behind your ear, it will give posterior auricular and the occipital artery. Medially, it will give ascending pharyngeal artery, and the terminally, that is the terminal portion, it gives the biggest artery, that is the maxillary artery. You will see that how the maxillary artery has been divided into three parts further and how it supply the most of the part of oral cavity, and it will give superior temporal artery. So the red words or the red terms or the red arteries that I have highlighted in this slide, that is lingual artery, facial artery and the maxillary artery. These are the main three arteries that supply the oral. Now let us discuss how each artery or which part of the of external carotid artery supply which part of oral cavity. Lips, supralabial and the infralabial lips. Supralabial is the upper lip and the infralabial is the lower lip. They are supplied by the facial artery. The palate is divided into two, that is the hard palate. The interior two-third of the palate is called the hard palate and the posterior one-third is the soft palate. The interior two-third, that is hard palate, is supplied by the greater palatine artery and the descending palatine artery. These are the branches of the maxillary artery. The next one-third is called the soft palate and it is supplied by the ascending palatine artery, that is a branch of facial artery, greater palatine artery, that is a branch of maxillary artery, and the palatine branch of ascending pharyngeal artery. The tonsils that I have shown you with an arrow, they are supplied by the tonsillar branch of facial artery. The blood supply of tongue. Blood supply of tongue, the main is lingual artery. On the right diagram, you can see how beautifully the lingual artery gives away its branches and supply the tongue. The roots of the tongue, they are supplied by the tonsillar artery, that is a branch of facial artery. Same that supplies the tonsils. And the ascending pharyngeal artery. The venous drainage is mainly by the deep lingual vein. The right diagram, the blue highlighted tubules, they are the venous drainage and they mainly come from the internal jugular vein. Now the blood supply of maxilla and the mandibular teeth. The upper teeth, they are referred to as the maxillary teeth. The lower teeth, they are referred to as the mandibular teeth. The upper teeth, as I say, that the anterior maxillary teeth, that is incisor canines, they are supplied by the infraorbital artery branch of maxillary artery. The posterior maxillary teeth, that is premolars and molars, they are supplied by the posterior superior alveolar artery, that is a branch of maxillary artery. The lower teeth, they are the mandibular teeth. They are supplied by the inferior alveolar artery, buccal artery and the lingual artery. Now let us summarize the entire slide and Let me explain you one again how they are distributed and which part of oral cavity is supplied by which artery. The external carotid artery, it gives away lingual, facial and the maxillary artery, as I have explained you earlier. The lingual artery, it supplies what? It gives away four branches, that is suprahyoid. The suprahyoid supplies what? You can learn it very easily that suprahyoid supplies the something that is attached to the hyoid, that is muscles of hyoid. So suprahyoid supplies the muscles of hyoid. Dorsal lingual, sublingual and the deep lingual, they supply what? Tongue. Lingual, so you can remember tongue. Soft palate and the sublingual gland. Now the facial, it gives away ascending palatine, tonsillar, submental, glandular branches, superior labial and the inferior labial. They supply soft palate, palatine tonsil, root of tongue, submandibular and sublingual salivary gland and the lips. Now the maxillary, that is the third part of the external carotid artery, is the terminal part as I have explained. It gives away three parts. Mandibular part. Mandibular part means it supplies obviously the mandibular area. The mandibular, it supplies lower teeth, mylohyoid muscle and the cheek. The muscular part, that it supplies the muscles of mastication, that is masseter and the temporalis. Pterygopalatine part gives away descending palatine. It supplies hard palate, soft palate, palatine tonsil. Posterior superior alveolar, it supplies upper premolar and molars, and the inferior orbital, it supplies the upper teeth. Thank you.